Thank you very much.
Good morning, everyone. My name is Dorte my name is actually Dorte Lastein, but I normally just go as Dorte, so I'll keep to that one. I'm here today because I'm a veterinarian like most of you, and I've worked in practice like some of you. And I also have a PhD in sort of what could be called applied practical epidemiology. But the thing is that I didn't only stick to epidemiology. I sort of turned it into what you could call mixed methods. So when I was preparing myself today, I was sort of said, I'd be honored to be here to speak after Dr. Nordhuisen, as he's one of the big old men in the country where I come from, Denmark, where we have a long, long tradition of herd health management program. So I'm sort of grown up in this system, and it's been law implemented for years and years where I come from. And I'm not just honored anymore. I'm actually thrilled, because Dr. Nordhuisen mentioned a lot of aspects that is important, in my opinion, in the herd health management aspect. And so I'm thrilled now, and that's good, because I was thrilled that when I saw that the next speaker coming after me was actually into qualitative methodology as well. So here we go. And that's where my presentation will sort of fit like a hand in a glove into how does a vet that has been both in practice and in academia and back in practice and now into teaching at the veterinary college in Denmark, the University of Copenhagen, how does I try to make a framework for these things to happen when I worked out there? How do I put things together in my brain so I could sort of move towards the best recommendation for each specific situation in a specific dairy herd? So that's why I'm here. And it all actually started behind the cows. I was much younger. I was wearing gumboots and long gloves and had a lot of enthusiasm, and I did a lot of hard work. But then something started nagging me. A question mark turned up in my head. I was doing all these routine examinations, as Dr. Nordhuisen was talking about, scoring hooks, doing rectal palpations, trying to organize all the schemes that he had put on and showed you. But it was so difficult, and to stay in the same wording as he has used, how do I prioritize these maximum 5 issues that I should help the farmer with? So I put the question to myself in sort of all my doubts. How do I give the best advice in a specific dairy herd, and not just a specific dairy herd, but at a specific question? Like, how do I organize my brain around that question? And I was in despair for quite a while, because the buzzword always tend to be evidence-based. And sometimes when you look up in the literature, it seems as if evidence-based means reading big books, reading the most recently published articles in Journal of Dairy Science, and I didn't find the answers. And it really left me there with a big question mark. But then one day I read a definition of evidence-based proposed by Sackett and his co-workers in 1996, and they were sort of trying to define what evidence-based medicine is and what is not. And I was filled with hope, because they explicitly join the forces of humans, the patient, and the scientific evidence. So here we go. I put the humans into the equation, just as Dr. Nordhuisen did, and was sort of telling us about before. Well, but to come back to my sort of applied epidemiology, I had to split half and conjugate, as you would say when you code. And you say, so it really didn't fit this human medicine into our dairy context. So I had to sort of think, well, who is the humans in this room? And that was the veterinarian, and there he goes. He's got a cow right in front of him. And then the patient. Who's the patient? Well, the patient could be the cow, and it could be the farmer. But the farmer is also a human. So I put the farmer on the human side and not the patient side in this thing. And the patient in my context here would be the cow, because I can't still, despite being brought up in a country with big herds, rather big herds, of course not compared to all countries, but I still have the feeling that a cow is a cow, and then you have a lot of cows, and they are a herd. So we have the cases, and that was what Dr. Nordhuisen said. We have the cow, and then the cows in the herd. So there's the patient. And then we have the scientific evidence. And this is where I sort of have to rephrase some of my former suggestions on how I would define scientific evidence. If you look at the green, sorry, I'm not colorblind, the green one, that circle refers to context data, local data, and local analysis, all the stuff that Dr. Nordhuisen told us about. And then normally this blue one, and this is a sort of hierarchy of evidence with meta-analysis on top and trials and as we go. For quite some time, I referred to that as general evidence, but we should all think about the representativity of whatever studies you and I do and whether they actually do apply to the local context. So I think the next years coming around, I would call this circle for less local instead of local. So, well, we've got the scientific evidence. And now, I thought, I've got my evidence-based. This is the components that I need. But maybe I missed something. I looked at this one, and I said, I've got them all. I'm sort of getting my mind around it. If I put them together, I have to put something in the middle there. That my answer, if I can put my answer in there, it'll be fine. But I missed something. I missed out on the society, and that's a really important thing, because society frames us all, and if I was a vet in Japan, I couldn't do the same stuff as I do in Denmark, and the other way around. So all the cultural and legal implications of our societies and the consumer's demands that sort of affect my best advice too. So there we go. There's my framework. This is sort of how I think it when I'm out there to prioritize with the farmer. Where can I fit all these things together? And then it gets complicated, because you think, what do I put into these circles? How can I actually fulfill all this? I'm just a veterinarian, and I'm used to being with the long sleeves and the gumboots. And yeah, that is, maybe we need more competences, or maybe we need, exactly as Dr. Nordhuisen said, we need a team. I won't go through all these one by one, but these are some of the things that all my interviews and all my clinical trials and all my reflections, as you would call it in qualitative research, sort of came to my mind. We need to be good at all these things, either one by one or in vet teams, or maybe even more broad teams when we work in large dairy farms. And I have only got 4 circles here. And that's because the farmer comes on top. Dr. Nordhuisen said it already, so I'll quote him. He said, it's the farmer that takes the decision. So he sort of, the farmer overrules any decision that's taken. So that's why we as a veterinary, in our veterinary profession, need to have more insight into psychology and sociology. Sometimes we have to be nearly teachers and have to coach, and maybe coach in different ways. And we need to help them to structure, and we need to help them to become better leaders for their workers. Yes. And then the big question is, in my use of mixed methods, how do you actually communicate? How do you perform qualitative research? And for persons like us trained in veterinary science, it can be quite difficult, because what it all comes down to is actually that we have to listen more than we speak. So this would be my pledge today, that we'll start asking more questions, listen to all the irrational issues of the farmers, and I hope that we will actually start hearing where we can find the answers, because an advice is not the best if it's not implemented. And this is the only way we can get these farmers to, I think, to implement whatever recommendation we give them. Thank you.